patient's position. They have to be sitting in a chair with nothing under their leg. Because, straighten your leg. If her leg is on a table, I can't get underneath it, right? So you have to have, so we're going to put that strap on. If her leg is contracted, tighten your quad. Can I move her patella? No. Bend your knee. Can I move her patella? No. So you want to make sure that she's in a good position. So sitting, leg out and straight. You're good. You're good right there. Straight. And relax. It's just like if I was mobilizing her patella, isn't it? So we're just going to mobilize it with something else and hold it there. So our goal is to take her patella and move it over and keep it there, eliminate her pain, and then while she's wearing it all day long, she will have a constant stretch on her lateral retinaculum. Her patella will be right in the middle of her groove, so no matter what she did with her quad, she'll have good tracking, and then she'll retrain it. And then we can start the manual therapy portion and all the therapeutic exercise. So this is just the beginning. This is just to change the anatomy. This is one part of a very long system for eliminating patellofemoral dysfunction. Okay, so they have to keep their legs shaved, clean, alcohol. Why don't you wipe your leg off? Really good with alcohol. So all the way from here to here. Why don't you do it? So here's the tape patch, and it's unique in many ways. This white tape that's going to come in contact with her skin has holes in it. It's made for people with skin problems. So it really does have, you can put it on anybody's skin and it won't irritate them. And we merged it with another tape that would hold the form of it and hold the Velcro circle. What else, and this is what you're going to move the patella with. What else is unique about this tape patch?
It's not centered.
It's off-centered. So this wasn't like one drunk night in San Diego and they're making patches. It was by design because most of the time, now she's a really good example of this. Most of the time, you're going to pull the patella which way? Medial, right? So you want more tape purchase on the lateral side. So you're going to put it on her like this with the tape toward the lateral side. And you're going to do that anyway, no matter which way you pull it. But she had, what did she have? What malalignments? She had a medial glide, a lateral tilt, and an external, very good, external rotation. However, when we felt her knee actively, which way did her patella go? Big time lateral. So I'm going to treat her like a lateral glide because what's important to her is when she's active, right? So when she's active, her patella goes lateral. That's why you see some of these lateral retinacular releases. When they release them, the patella sits medial, but then when you go to ask them to contract it, it comes lateral. So treat those people, if you find them, as a lateral glide. Okay? So I measured her leg, and I'm quite certain this is probably her size, but we're going to put this on first. Go ahead and do it like this, and then pull it up your leg, and we'll just check and make sure that's the right size. It should be snug, but it shouldn't be cutting off your circulation, and it shouldn't be too loose. This doesn't have to be cut. All this is to attach something to. So fold it back in half and just pull it down so you clear your leg too. So the only reason to put this on is the back half of this is all the opposite of the Velcro, so you have something to attach it to. This is going to go on her leg the same every single time. And I'll show you how I do it. I apologize, I'm going to put my back to you guys, but I think you'll be able to see. So we're going to put this on her patella with the lateral side, the long sides of the lateral sides. What you want, as we move her patella, her skin's going to move a little bit, so you want to make up for that. So we're going to put this a little bit higher than her superior border, and this a little bit past her lateral border of her patella. Then when it moves, it'll be centered. So what we want to do is just take this tape off the back. And it's really easy for patients to do this once you teach them as a therapist what about their malalignments, what position their patella is in, and how to apply it. And it goes on the same every time, so this does, so it's really pretty easy. Palpate her superior and lateral border and place that over those landmarks. Now before you pull it down, check and make sure you like that. So her superior border is right there, I like that. Her lateral border's right there, I like that. So now I'm gonna take them both and pull them down snugly. Okay? So now what you're gonna do is, without bending your knee too much, is pull this up just so it's at the bottom of that, the circle. Keep going. Yep, and then pull it up. So you wanna make sure that the whole Velcro circle comes through all the way. Yep, and this will fold like your skin folds, in the back or whatnot. So just make sure it's all the way in. So you want to get maximum connection to that. May I have that, please? Okay, now you're going to make the correction with this. We're going to, for her first, we're going to correct her tilt and her rotation by pulling her patella medially. And in order to get enough pull on it, you have to pull both of these straps together. You can't pull one and then the other. You have to pull them both together. Just like if I was mobilizing your patella, it'll feel the same tube. You'll feel your patella move. But why did we bifurcate this strap if you need to pull them both together? Why did we split this in half?
Rotation.
Well, if I want to rotate her, I'm going to put it down like this. I'm going to rotate it up like that.
So that's not all pulling on one portion?
No. Yes. So when she bends her knee, she's not affecting the popliteal fossa. So she has a couple millimeters of a soft material back there. So you want to make sure that you take care of your veins, arteries, and nerves there. So we're going to put this right on the circle, and I'll show you. We'll do this one way first, and then I'll show you a couple other ways. Now, if I just pull on this, what's going to move?
Femur.
Her femur. So we have to stabilize her femur, just like you would if you're mobilizing her patella. Let me do that, and then I'll show you this. If I go like this and hold your femur here, and you relax, and I pull this, you feel your patella move? Yeah, me too. So if she doesn't feel it move, or you don't feel it move, or see it move, something's amiss with the application. So that's all it is we're going to hold her femur here, we're going to pull it over, keep the pressure on her patella, and put one strap above and one below the popliteal fossa. Now you're going to go for a walk. Just walk normally. Can you move that box back over, please? Go ahead. Come back. How's it feel? Okay.
I kind of feel like it kind of like cracked my lip.
You should feel like it's in a different position.
Yeah.
Now, as I said, this is one, just correcting the anatomy. Then you have to work on stabilizing the hip and everything else. So what are we going to do now? Test. So the comparable sign, right? So do it exactly the way you did it before. So stand behind here. We'll do both. So what was her first one? So those of you who looked at her from the front, could you look at her again and tell us about her quality of motion? Okay, same thing. Stay there. Any pain? Gone? Okay, that's what should happen. You should take your patient's pain away day one in physical therapy. If you don't take it away day one, then you're not doing your patient a great service, okay? Now come on down. What was our other test? Okay, so go down to the spot. I didn't mark it, but wherever you went before. I think it was single. Yeah. Well, no accounting for your balance, but
it feels like I kind of like that's probably weakness.
You think? Any pain? No. Good job. All right. So how often do people wear it? I've had people in it. I would say the average time they're in the system is about 3 months if they've had it for a long time. This is how I think everybody should be treated. The day they told their coach they had pain, he called me. They came down, we treated them, they went back up, and they were out of this and no pain in a week. So that really shows you what can happen if you treat somebody right away. I have patients wear it all day long. That way there's a constant stretch on their lateral retinaculum, and I know their patella's in the right position. As they get better, I have them wear it just for high-level activities like, well, she'll say, well, it doesn't hurt anymore when I sit in class. It doesn't hurt anymore when I do stairs, but it still hurts when I run. She'll wear it to run. Then she'll go, it doesn't hurt when I run anymore. Okay, so that gives you some idea of how you want to progress them. And then gone, then out. This is a way to fix the problem. This is not something you slap on your forearm before you go play tennis. Okay?